Welcome to the Business Information Buffet Podcast, also known as the BIB Podcast, where everybody eats, powered by the College of Southern Nevada. Each week, we'll be featuring business owners and entrepreneurs that will provide their personal recipes for business, powerful conversations, and knowledge of the business world. We amplify the stories of various backgrounds, cultures, and expertise. Our self-identity is as diverse as our social community. We cultivate a community of like-minded individuals that share their different perspectives, broadening our worldview. Are you ready? This is the BIB Podcast, where everybody eats.
Ladies and gentlemen, are you ready?
Welcome back to the Business Information Buffet Podcast, also known as the BIB Podcast, where everybody eats, under the operation of the College of Southern Nevada here at the North Las Vegas campus for another impactful, exciting episode. I am your host, Sean Tory, with our DJ Icebreak, and unfortunately, our brother is not here today, but we're going to rock on in his honor, ladies and gentlemen. Our episode today is called Blending Healthcare and Media with a special guest. Now, ladies and gentlemen, tonight, this special guest right here is an educator and a doctor. Okay, our guest today is the founder and CEO of the Public Health Pharmacist. Ooh, a pharmacist. Ooh, I like that. A public health consulting firm offering public health solutions during this pandemic and beyond. She is an associate professor and pharmacy practice with Roseman University of Health Sciences and works as a clinical pharmacist specializing in public health with a focus on infectious, communicable diseases. Oh my goodness, that was a tongue twister for me. She is a trusted and valued healthcare professional with over 15 years of experience in public health and 18 years experience as a pharmacy professional. Come on now. She has received multiple awards and recognition. She has personally facilitated an administration of over 11,000 doses of COVID vaccinations. Oh my goodness. Ladies, gentlemen, today, the doctor, the professor, the educator, the phenomenal founder of Public Health Pharmacist, ladies and gentlemen, Dr. Madison. How you doing?
Well, I don't even know how to come.
You don't know how to come
after that.
Come on,
because I mean, talk about an amazing introduction.
But was it? See, listen, I do the best I can. I just want to make sure.
No, honey, you are doing your best.
Thank you. Come on now, Queen. Don't hype me. Don't hype me up this morning.
Too late.
Thank you so much. No, thank you
so much for having me today, Sean.
Thank you.
Like I am honored and privileged.
Man, I'm honored and privileged to have you. Like I remember when Kevin told me about you, and he was like, "Yo, you need to have her on the podcast." I was like, I digged you up. I was like, "Oh, she's out here. She's doing her thing. Let it be known. Let them know." Please let the people know about you, ma'am.
Absolutely. So my journey, like many others, has been very unexpected. So, I've worked as a clinical pharmacist for many years. And at the beginning of the pandemic, I was asked to share my knowledge and expertise because I have this background in public health and nobody really knew about this new virus, right? And so I was thrust into the media, and since then have been featured in over 200 on-air appearances related to the pandemic as well as to public health. And so it's really been, so fun to just kind of marry like what I consider my two loves, which is healthcare first and foremost, because I feel very strongly about wanting people to understand what their healthcare options are, especially communities of color and the underserved, and our minority populations. And then on the other side, I love media. Like I love social media. I love writing. I love getting my message out there because I feel like the messenger is so important, especially as it relates to healthcare information. Because when you see somebody who looks and sounds like you, you're more likely to take their recommendations. And ultimately, when you can see it, you can be it. And for me in particular, working within pharmacy and working in the healthcare profession, I don't often see, women who look like me because I'm brown. in the public eye and in, more C-suite positions. And so I felt really strongly that representation matters and that I really needed to be out there, once I had the opportunity. So, long story short, worked in direct patient care, was really enjoying impacting my community and just wanted to take it up another level and have a greater reach.
Man, talk about a story. So can you, how has your experience, because are you from Vegas?
I am.
Born and raised? Oh, let's go.
Yeah. So let me rephrase that. I'm a Nevada native. So I was born in Reno. I always told my mom, I tease, I say, we effectively doubled the black population when I was born.
When you was born?
Yes, this is 1980, boo.
Because you know what?
It's a whole different time back then.
My oldest daughter, she was born in Reno because I went to UNR.
Oh, nice.
Yeah, so she was born my last semester when I was graduating.
Awesome. Yeah. So what used to be Washoe County Medical Center, which is now renowned.
Yep.
So I was born there. We moved down to Vegas when I was 2, and all of my education here. Left, did part of my training for pharmacy school in Hawaii, which was amazing.
Oh, wow. In Hawaii?
Yes. Yeah. I was on Oahu for about 8 months.
Okay.
So I was at Tripler Army Medical Center, and then I also interned at a Long's pharmacy, which was super fun. It was right in downtown on the bus route. I don't know if you know much about the bus in Hawaii. It's called the bus. It's very literal.
I didn't think, I was like, they were like, go to the bus. I was like, all right, what's the name of it? And no, it's the bus.
Bus.
I'm like,
it's super literal.
I was like, why would y'all do that to yourselves? Go ahead.
Right. So right on that main drag by BYU Hawaii, which is just right there. Mm-hmm. Just had the most amazing experience being at Tripler Army Medical Center. At one point, I actually thought about doing enlisted versus civilian position, which, going back now, I could have been almost retired because I've been a pharmacist for almost 20 years.
Oh, man.
But that's okay. We all take different paths. And then I also did a residency in Albuquerque, New Mexico. So I did a year residency in Albuquerque, which was also very enlightening because also a lot of rural areas, a lot of underserved. There was a couple times where I did home-based primary care, which is where we actually would go out to people's homes, and it was like a scene out of Deliverance.
Yeah.
It's a little scary.
Albuquerque, New Mexico is different for sure.
Yeah, it's very rural in some areas, and then also a large indigenous population.
Yes,
so I also want to give a shout out to our indigenous brothers and sisters for sure, because they ultimately do oftentimes have more challenges accessing the healthcare system, and so again, really just wanting to be a voice of reason and hope and light for our minority populations.
So then my question for you is like, but because of all the experience that you've gained, how has that prepared you to come back home and actually be in the medical field here? How has all your experience prepared you to serve our community here?
Yeah, I think that's what drives me. That's my motivation, is to give back to my community because it's given so much to me.
Right.
I have been very fortunate and very blessed. My family, we weren't well off, but I never wanted for anything. I was one of, many children, in high school that got a car on their 16th birthday. It might not have been the fanciest car, but I got a car. But that's a lot of people can't say that. And so I definitely feel like I have, in that regard, have been privileged because I never wanted for anything. I paid for my own way to go to undergrad. So I went to UNLV, and I worked all the way through school. So I always worked and went to school. Man. And that is, I would say 100%. And I lived at home, which was great.
Right.
And so I always tell people that if you have that option, we always want to spread our wings and leave the nest and go to college somewhere else. But when we think about how expensive getting a good education is, thinking of ways that you can still get that good education, but also not be so much in debt,
yes,
I think is hugely important, especially for people now, because actually my husband and I were just talking about this. The average annual tuition cost is $35,000.
No.
insane, right? Like who has that kind of money unless your parents saved up for you to send you, right? So like I was super lucky because I had a job that allowed me to go to school and to work, and they worked around my school schedule. So I was actually a bank teller. And I, I'll credit my experiences because I also was, so I don't know if you know about Creative Kids.
Yes,
so Creative Kids is the daycare center here. And they used to take us on all these different field trips. And one of the field trips that we took was to a bank. And so I was like, I want to work for a bank. Not to mention that financial literacy is extremely important.
Definitely is.
And so that was my first job. That was my first job in high school. I was a bank teller. Which, by the way, we got held up, which was also a very interesting experience.
Held up, robbery held up.
Yes, with a weapon held up. Yeah. So I've lived some life.
I've seen that.
I lived some life. So that was my first experience, and then figured out that I really liked healthcare. I was a biology major with a chemistry minor. Had an amazing mentor at UNLV. He still works there, Dr. Lloyd Stark. And I was working in his undergraduate lab, and then he helped me to apply for pharmacy school, and then the rest is kind of history.
See, that's phenomenal. Come on now. What a story, ladies and gentlemen. So can you think of a time where you planned something and it didn't go accordingly? How did you make it work?
Well, I'll say the rollout of my business. So let's start with that.
Let's start there.
Yeah.
Come on.
So I decided I was going to start a consulting business in November of 2019.
Ooh.
And part of my business plan and strategy was professional speaking and being keynotes.
Right.
So I had all that. And I said, 2020, you my year. I'm going to get booked. I'm going to have all these amazing speaking opportunities. And then bam.
The pandemic.
The pandemic had other plans.
Dum, dum, dum.
Yes. So I had to pivot and be nimble like everybody else. And then that's when I really got kind of pushed more into the healthcare media contributing space and was asked to, be this healthcare on air expert, which was an amazing opportunity. And so, it wasn't what I planned.
Right.
But I made lemonade out of lemons.
But that's how you get your recipe in there. You see what I'm saying? That's how you start to make that recipe. All these experiences, all this part of your journey. That's how you make that magic right there, ladies and gentlemen. So what are some things you've experienced that could have worked out in theory, and I guess you answered this too, but did not go that way in practice?
Well, one of the things that I thought that I was going to do after I pivoted, was that I was going to do all of this consulting work for businesses around the pandemic, right? So I was like, I'm gonna help these businesses be able to bring their employees back safely. I decided I was like, I should probably get a business partner. I got a business partner, and that didn't work out as well as without.
We know how that goes.
And then, spent too much time trying to make sure that the agreement between two parties was good, and we missed our moment. And because nobody was doing it, and then by the time we figured out what we were doing, a bunch of businesses were doing it, and so we weren't able to take advantage of that opportunity. And so for sure, I would say for anybody who's thinking about having a business, or anyone who currently has a business and has an idea, go with it, run with it. It doesn't have to be perfect. I am all about the messy yes, because I think a lot of times, especially right now, because there are so many people that are becoming entrepreneurs or starting their entrepreneurial journey, it doesn't have to be perfect, but when you have a good idea, like, you got to meet the moment and don't let it pass you by, and don't let the enemy, be perfect, be the enemy of the good.
If I can add to that, trust the process.
Yeah, absolutely.
And your process is not going to be the same as everybody else, but trust the process and keep going. There's going to be moments where it's low and it's looking very slimish. We know, I use Spike Lee sometimes, because Spike Lee went into debt making his movies, and now look at him, right?
I know, right? Yeah, absolutely. I mean, it's return on investment, but it's also opportunity cost.
Yes.
So sometimes you may do something, without being necessarily compensated, maybe with actual dollars, but
Yeah.
You know, but that opportunity
Right.
led to something else that maybe was revenue generating.
Right.
Right. And there's been times where, you know, I've maxed out a credit card.
Ooh.
And, you know, maybe had to stay in an airport instead of a hotel. Yeah.
Man.
To do what you got to do and to, you know, follow your dreams and follow your passion. You know, I recently found out that I will be doing a TED Talk this year.
Come on. You can do a TED Talk?
Yeah.
That's dope.
So I, you know, when I was planning this and manifesting this, because I manifested that.
Come on, manifest it. Manifest that.
Yeah, I manifested that for sure.
Jesus said.
I put that out in the universe and I said, I'm going to get it. I'm going to get it. And I got it. And I got it. So May 21st, I'm going to be doing, TEDx Reno.
You said May 21st?
Yep, May 21st.
That's my bachelor party.
It is a Saturday.
Yes, it is Saturday. That's my bachelor party day.
Yes, that's okay. Priorities. I got you. Yeah, no worries. But when I was developing the idea and when I was thinking about, you know, what are things that I can do to maximize my success?
Right.
I hired help.
Love that.
And I think that's one thing that we forget as business owners or new within this space is that we forget to invest in ourselves.
Agreed.
And sometimes you got to spend money to make money.
Yeah.
And I'm a true believer on that return on investment. And so I ask for help. And that's hard. It's hard when you've been doing the same thing over and over again and you're good at what you do, but now you're going into a different space.
Right.
And the entrepreneur space was brand new to me. Like nobody taught me in pharmacy school to be on camera or to like own a business and to have consulting contracts and to hire an attorney to make sure that like my image and likeness wasn't stolen and used without my privilege.
Right.
You know, nobody told me that stuff.
And those are things that we learn along the way at times. And it's like,
you flying that plane while you're building it.
Man, listen. And we figure it out, and sometimes we figure it out very smoothly, which, you know, I thank you so much.
It was smooth with this one. No, it's choppy.
It's choppy? It
was choppy.
but look at where you at now. Look at her now. Dancing with joy. You see her? I see her too.
I'm a quote Cory Booker. Nobody's gonna steal my joy. Nobody's gonna steal my joy. That's right.
Let them be known.
Amen.
Mm-hmm. You know, I'm sorry. I got to do this to you. Are you ready?
Oh no, what you gonna do?
I got to put you in the hot seat, man. I got to put you in the hot seat. So now in this segment, man, this is where we ask in-depth questions to learn more about you as a guest, right, in your business. So we used to do rapid questions, but now it's just straight in-depth questions. We want to get to the meat. We want to get to the root of what's going on with you.
Ribs.
Could we do that, ma'am?
Of course.
All right, ma'am. So first question. What are the challenges you face with the public health pharmacist?
Waking up black.
I'm sorry.
Didn't expect that, did you?
Did not expect that at all. I'm sorry, I did not expect that. Okay.
Yeah, I mean, I'm going to be honest and real.
I love the transparency.
It is the fact that, you know, minority businesses often have to borrow money from family and friends. We typically don't get investor funding. Mm-hmm. We're not going to see a lot of angel investors or venture capital. It's hard. It's hard to start a business when you don't have capital.
Yeah.
It's hard to start a business when you don't have the support. Right. So I use SCORE. I don't know if you know about SCORE, but SCORE is a federal program that helps all individuals start businesses, and it's free. And it's and they get you a mentor, and you can meet with your mentor. It's all over the country. It's a free federal program called SCORE. SCORE.
Okay.
Yeah. So I'd highly recommend that, as well as being a member of your urban chamber, as well as your women's chamber.
Yes.
And then I also am involved with the National Association of Women Business Owners.
Come on now. Talk that.
Yeah. So those are all things that help you along your way. It's like you have to build that tribe in order to get that support that you need. Because I know as a minority business owner, things are going to be more challenging for me. And you need that support, and you need someone else to be your cheerleader. And I always say my husband's like my biggest hype man. He's the best. He's like my best friend. He's amazing. He's started doing this thing in the mornings when I leave for work is he goes, honey, slay the day.
Slay the day.
Honey, slay the day. You got this.
I like that.
And I tease him and I'm like, you're like a walking Hallmark card, but you know what? You need that.
Yeah.
You need that. And as much as I think that I'm strong and that I can do everything on my own, I can't.
Right.
And I think that misnomer in particular for Black women, that we are always strong, that we can do everything, that we can be everything, it's daunting.
Right.
And just waking up Black is hard.
Man. Whew, I did not expect that response, but I love it. I love it, ladies and gentlemen. So what are the benefits in the public health pharmacist?
Ooh, there's lots of benefits.
What's the benefits?
Well, guess what? Last time I checked, public health wasn't sexy.
No, it wasn't.
So I'm bringing the sexy. So there's that.
Okay.
So so that's my goal, right? So I'm bringing a little more fun to an otherwise dry topic.
Dry topic industry.
And something that people don't want to think about. Because here's the thing. Most individuals, especially when we think about medication, they'll take something if it is for something that they have, right? So a disease, a disorder, a condition, because it's like, oh, you're giving me medication to treat something. And when you treat it, it'll go away, right? With public health, it's very challenging because it's all about the health of the many versus the health of the one. And so when I talk about public health, it's all about prevention. And so it's hard for people to abstractly think about them taking a medication or getting a vaccine to prevent something that hasn't happened yet.
That's powerful.
Yeah. And so that's why, my big thing is preventative health, preventative medicine, food as medication, right? Really thinking about healthy eating habits and how, unfortunately, years of, individuals living in communities with food deserts, pharmacy deserts has led to them eating processed foods. It's not them and their ethnicity. It's the number one thing that is a predictor of our health is our zip code.
Yep, that's very true. That's very true.
So when we think about population health, which is, part of public health, it really is overcoming those health disparities and overcoming those barriers to access to care.
I agree. So then my question for you is, like, with all this knowledge that you're pushing out to the media, everything that you're giving, how was that transition from because you're still a pharmacist,
of course,
and you're still doing that. How was that transition? Because I would say you're in the entrepreneur world and being a pharmacist. How was that transition?
Well, the transition has been really interesting and obviously very educational, right? For lack of a better way to say this. It's been an exponential learning curve, right? Because I've had some failures. I'm going to fully own that.
Yes, please do. That's
because
about the show.
There are things that have completely fallen flat. I was like, oh, let me get a bunch of like UV lights with my branding on it, and I'm gonna sell them. That seemed good. That seemed like a good idea. Ooh, that didn't go so well. But my hand sanitizers, everybody loves hand sanitizers. But like certain things like that where you're like, you think that it's going to work out really well and then it doesn't. But, ultimately, I think the transition for me in particular was always being camera ready.
Right.
So that was a huge transition because I was somebody who like never wore makeup, like didn't do, much with the hair. Like I always dressed well, but like the whole being camera ready and understanding like there's a difference between wearing clothing for your enjoyment versus wearing clothing that looks good on camera.
That's true.
And so it's very different, right? Because I like patterns and colors and and that don't look good sometimes on camera. And so learning that was a huge change.
Because learning what colors work on your skin tone, essentially.
Yes.
Like you have
things
to
that wash you out
or darkens you, like all that. Yep.
Yes. And guess what? Lighting is key. Oh, my lighting is key.
Let's not talk about the lighting here, but we gonna make it work. We've been making it work.
Yes, these fluorescent lights are not good for my skin.
No, not at all. That's why I like windows. But that's another conversation.
Yes, natural light is always best.
Always best. But guess what? You made it through the hot seat. See, it wasn't
That's
that bad.
it?
That's it. You made it to the hot seat.
I didn't know that was going to be, I thought it was going to be worse.
Well, no, it wasn't gonna be. But I get everybody every time. That's my favorite segment. I'm not gonna lie. I get people all psyched out, and then they're like, "Oh, it's not bad."
Yes.
No, it's not. I promise you. So the next segment, we're gonna put you in the
You don't got no
sauce.
sauce, then you're lost.
Because you get lost in the
You
sauce.
also get lost in the sauce.
So
Hopefully it's spicy.
exactly. So in this gives us more insight on our guest, where we ask you, what's your special ingredient for your business? This is where you tell us why nobody can replicate what you do, right? So if you could, Dr. Madison, tell us what makes your business a business nobody can duplicate what you do.
Ooh, I think it is. So my personality, I think, because again, not to, say anything negative towards my profession, but pharmacists are not usually thought of as being personalities,
Right.
or having a personality.
Right.
And so, I mean, I don't know the last time you went to your community pharmacist.
I went,
but
well, 'cause
did they tell you a joke?
Nah,
Did they
she was
ask you how you were doing?
Yeah, she did.
Oh, that's good.
She
That's good.
she did that, but she was very quick to the point, because I had to go to the dermatologist because I have this acne keloid stuff. So I had to put cream, and I had to take this pill every two pills a day, and then put this cream on my neck. And
Well, first of all, thank you for sharing.
Yeah, I had to, because I think it's important to know, like, when you have folks, like, because in Reno, in college, at the time they didn't have the best barbers, and I had a barber that messed me up pretty bad, and now
So hair is very important.
it's very important. But like, luckily I was still able to grow it, but I can't keep my hair short, so like waves is out the quick. Like my doctor told me, like, we're like, yeah, essentially it's best you just grow your hair. I was like, oh well, all right. So I haven't had my hair long in a while, so now to do that, it's like, all right, well, got to do it. And then when it falls out, and ride to the road fall out. But that's the last time I went to the pharmacist.
Yeah. So again, I think that traditional thought process of what a pharmacist does is that they're behind the counter. And my job, and what I'm trying to do with my business, and why I feel that I am unique and therefore can create value and have value, is because I feel like I am expanding the public's mind about what a pharmacist can do, and all of the different ways that a pharmacist can impact their community and improve your health and wellness.
Gotcha. So what would you say is your secret ingredient to where your business is flourishing?
Oh, my secret ingredient I think my smile.
Okay, yes, ma'am. I see it. Yes.
Yeah, I would tell you, during the pandemic in particular, I had a lot of, minorities come to me and tell me, how excited they were to see somebody who looked and sounded like them on TV. Right. And then not just that, but when they would go to the vaccine clinics, that they would see that I was the one running the clinic.
Right.
And that gave them comfort. And they were like, oh, I thought I considered maybe not staying, but then when I saw that you were not just the one that was here, but that you were running the clinic, and everybody was listening to you, they knew that they were going to stay.
See, that's love. I love that. See, because those are things that add from your recipe that give you
don't got
that
no sauce,
sauce. So you better go ahead and let that be known, ma'am.
Yes, it's that welcoming smile. It's that, well, not just that, but, I think the thought process of having automatic perceived competence. Right. And that's not always a given for women in particular. And so I really think that because I have a demeanor and a poise about myself that is welcoming and open, but also has authority and breeds that competence, is very helpful.
See, I love that, man. So, Dr. Madison, I want to thank you for just providing us all this knowledge, this wisdom that you gave us on the show today. You taught me something today. You taught me a lot today that I didn't even take into consideration as someone I'm someone who's big on health, and to take the the special, I wouldn't say speciality, but the career path of a pharmacist in which you all go through. I salute you. I thank you. And now I want to transition to our last segment of the show, which is, ladies and gentlemen, the happy hour, ladies and gentlemen. Actually, I got something for you. If you can hand me that to me, sir.
I didn't know I was gonna get a gift.
Yes, ma'am. On behalf of the Business Information Buffet Podcast, also known as the BIB Podcast, that is for you. Yes, ma'am. And in this segment, this is where we take a toast between the guest and the host, where we toast the success, whatever's going great, big or small for you. So, good ma'am, Dr. Madison, what is something we can toast to for today?
Toasting to my TED Talk.
Second, that's right. May 21st. We both turn it up in different ways.
Very different.
But toast to you and all the success in your TED Talk that is coming in your business. Yes.
Oh, dang. You just drank that all down, didn't you?
Old habits.
Ooh, I'm a sipper.
Yes, definitely. It's okay. You can definitely sip. And ma'am, Dr. Madison, if you can please tell people where they can find you.
Absolutely. You can find me on Facebook and Instagram at The Public Health Pharmacist, on Twitter at Public Health RX, or you can go to my website, thepublichealthpharmacist.com, and you can see some of my media appearances. I have my reel up there. And then also you can find me at TEDx Reno, because my bio and all my goodies is up there now, because I am one of the speakers for this year's TEDx Reno conference.
Man, that's lovely. Thank you so much again for coming on the show. And ladies and gentlemen, I never actually say this, but I need to. Make sure you all follow us on social media. We are on Instagram, the.bib.podcast. We're on YouTube, Anchor, Apple Podcast, Spotify. You can find us at The Bib Podcast, please. And also our website, www.bibpodcastmv.com. You can find us all of this, please, ladies and gentlemen. Thank you so much. All the social handles, ladies and gentlemen. Thank you, Dr. Madison.
My pleasure.
Deeply appreciate you. Ladies and gentlemen, that is the end of our show for today. This is the Business Information Buffet Podcast, also known as the BIB Podcast, where everybody eats. I am your host, Sean Tory, with our DJ Icebreak, and we'll see you next time.